Good afternoon, and welcome to the City of Toronto's COVID-19 media briefing for Friday, October the 9th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon, and thank you, Brad. The number of new cases of COVID-19 continues to climb in our city, along with the number of people in hospital and in the intensive care units. I know that people are concerned about where this is heading, and so am I. And I've been working with Dr. Davila and with the province and with the Government of Canada to fight this resurgence. We continue to work together effectively to fight COVID-19 and to bring relief to those negatively affected. But the progress we have made over the last almost 8 months attacking this virus, reopening schools, protecting seniors in our long-term care homes, is at incredible risk. We know we have to confront this resurgence aggressively, with the help of each and every resident to bring it to an end as soon as possible. Today, provincial officials took action to do just that and moved Toronto and other cities facing rising case numbers into a modified Stage 2 to help stop the spread of COVID-19. I support the Premier and the province in taking these actions. This is in line with Dr. Davila's recommendations, which I supported last week. She has been clear that this 28-day pause focused on key areas is needed in order to stop a larger and longer lockdown from becoming necessary in the future. I want to publicly thank Premier Ford for doing what I believe is widely seen as the right thing to do, consistent with the advice of our public health professionals. I know he's been working non-stop to fight this virus, and that he cares deeply about all those who have tragically lost their lives and those who, through no fault of their own, have seen their businesses or their jobs or both threatened through this nightmare. He knows, as I do, that a healthy economy requires, first and foremost, healthy people. I know these decisions taken by the Premier and the Cabinet today, on the advice of the Chief Medical Officer, were not taken lightly. How could they possibly be? No one wanted to have an increase in public health measures. It's an agonizing decision for all of us, including those who advise us to take these steps, because we all know the frustration and the heartbreak that this will cause for many people and businesses directly or indirectly affected. Our restaurant industry in Toronto is the best in the world. We are taking efforts all the time, and we want to take even more efforts to build it up. But the public health advice was clear, that closing indoor dining right now is needed to help stop the spread of the virus. It is something being done to fight COVID-19 in many other cities around the world. It is indeed tough medicine, but it is based on a consensus of the best available advice, because clearly the status quo was not an option with regard to generally how we were handling the virus. Today, Deputy Prime Minister Chrystia Freeland announced help for the restaurant business and the businesses impacted by COVID-19 and by public health measures. This is something that she and I have been discussing almost daily for weeks, including discussions with the Prime Minister, and they, the Government of Canada, Prime Minister Trudeau, Deputy Prime Minister Freeland, they have delivered. This assistance is so important, and I want to thank the Deputy Prime Minister and the Prime Minister and our MPs from Toronto, with whom I met on Monday night, for answering our call for help on behalf of the industry, the restaurant industry, and other small businesses, and working with us in turn to get this announced and implemented at wartime speed. I was texting Deputy Prime Minister Freeland late last night and early this morning, and her swift action proves that she understands how important this relief is. I also welcome the fact that this funding is retroactive to September 27th. I think that's very important to many of these businesses. I'm also very grateful for the support that was announced by Finance Minister Rod Phillips and the Province of Ontario this afternoon. Their backstopping of many of these same businesses, including restaurants, will help defray fixed costs, sometimes substantial fixed costs, while public health measures are in effect. I had a discussion with Rod Phillips about that this afternoon. And beyond thanking him and thanking Premier Ford for this assistance, we also talked about how some of this support might end up being delivered through programs that are administered by the city, and I indicated to him the City of Toronto was more than willing to help in any way possible to make sure this support is quickly and efficiently and effectively delivered to those businesses who require it. It shows, these measures show the cooperation that has been exercised over the last number of days discussing appropriate public health measures shows that this is an all-hands-on-deck effort and that all governments continue to want to work together and to, in fact, work together to save lives and to help keep people healthy. And this is in stark contrast to what we've seen happening in some other places. At the city, we have worked to support restaurants through the Café TO program, parts of which have been extended for as long as we possibly can. And recently, I asked our city staff to look at a winter patio program. I received an encouraging update on the winter patio efforts this morning, and I expect we will have more details on that for the businesses that can take advantage of that sometime next week. There are things we can do to help make outdoor dining an option for some restaurants and for people in the City of Toronto. Destination Toronto, the organization that helps support visitors and tourism, whether it's from outside or inside the city or the province, with the support of the city, will also be ramping up its efforts to help residents connect with local restaurants for takeout, delivery, and patio service. The program, called To Go Toronto, will be relaunching as soon as possible, and advertising efforts supporting it and promoting it will also be rolling out and will be stepped up. I strongly encourage all residents to support restaurants as much as they can by ordering takeout and delivery or by visiting a patio. But again, on visiting those patios, respecting public health rules while doing so. These restaurants, these businesses need this help now, and it will make a difference, and I hope people will take this opportunity to help, and for that matter, to sample some of the fantastic fare that our restaurant industry offers to us each and every day in this city. It's the envy of the world, and we should be taking advantage of it and helping them at one and the same time. In line with these updated public health recommendations and rules, we announced this morning that we are adjusting some of the city's recreational programs. The suspension of the impacted programs will now start tomorrow, meaning midnight, 12:01 tomorrow, given the provincial announcement. No one wants to reduce the number of indoor recreation programs we offer, especially after so many people had signed up and look forward to that kind of thing at this time of year as the weather changes, but this is absolutely necessary based on Dr. Davila's advice to help us confront this resurgence successfully. I know that the suspension of these indoor recreation programs, which are outlined in detail on our website, will be frustrating for those who are signed up and who are looking forward to these activities. So, in order to try and defray some of the bad effects of this decision, I've asked our city staff to work towards developing some supplementary outdoor colder weather activities that people can take part in this fall and this winter. So city staff are working right now to adapt recreational activities that could be offered outdoors wherever possible, and to ensure that residents across the city are aware of outdoor recreational activities that exist at present and that are not affected by these changes to public health advice. The city continues to operate a number of programs with capacity restrictions and other health measures in place, including the leisure swim and skate, the lane swimming, after-school recreation care, December camps for children, and our drop-in youth programs that do not include sports. All of the city's outdoor amenities in parks, green spaces, sports fields, skate parks, trails, BMX parks, tennis courts, basketball courts, outdoor fitness equipment, picnic shelters, and playgrounds, all of those remain open. I know this will be a hard Thanksgiving for the businesses affected by today's provincial announcement, and for residents who are respecting, as I hope everyone will do, the public health advice, and by so doing are not gathering with their friends or with extended family. These are extremely trying times for so many people and for so many businesses, and we are doing everything we possibly can to help people and businesses get through this terrible period. We have to get through it, and I'm confident that we will get through it. Dr. Davila's advice is crystal clear for this weekend, and we'll probably all repeat it in one way or another because we have to make sure everybody understands it and that we all do our very best. Please do not hold big Thanksgiving gatherings. Please limit your Thanksgiving dinners and other gatherings to people you live with under the same roof all of the time. And if you live alone, the safest option is to join with others virtually. I hope that if we all do the right thing now, we will have a real shot at a normal Christmas, one where we can do all of these things that we're being asked not to do at Thanksgiving. And notwithstanding this ongoing nightmare, we do have a lot to be thankful for as residents of the City of Toronto. Of course, for our families, for the wonderful city of opportunity in which we live, for our medical professionals and other frontline workers who will help us to stay healthy and have been doing so much to help us stay healthy all this time, and for the embracing, respectful way of life that we enjoy here in Toronto. All of those are things that we should be thankful for, even during pandemic times, and perhaps especially during pandemic times. All of them should also be reasons for great hope. Please have a happy and safe and healthy Thanksgiving, despite everything. And I would now, on that note, like to invite Dr. Davila to give her report for today.
Good afternoon, and thank you, Mayor Tory. This is an important day for Toronto, possibly the most important day in this fall's resurgence of the COVID-19 virus. If we think of COVID-19 like a forest fire, the announcement today by the provincial government is a fire break. We face a natural force poised to either burn out of control or to become something we have the ability to bring under control. Today's announcement is a dividing line. We now have an opportunity to reduce and reverse the COVID-19 infection rate in Toronto. An opportunity that comes at a sobering moment, with sobering numbers on which to reflect as we head into the Thanksgiving weekend. I am reporting 350 new COVID-19 cases today. The new count brings our total cases since the pandemic started to 21,919. Today, 95 people in Toronto are in hospital with COVID-19. 26 are in the ICU, and 12 are intubated. In Toronto, there have been almost 2,000 COVID-19 cases reported during the first 8 days in October. This figure represents almost 10% of all of our cases since the beginning of the pandemic, in just 8 days. We are now positioned to challenge the spread of COVID-19, but we cannot forget it is always ready to erupt if we let our guard down in our daily lives. It is likely there will still be several weeks of sobering news to come, but I think there is now reason to believe that through these temporary restrictions, we can blunt the toll that resurgence will take. I know that there are people who will feel the effects of this course of action much more than others, and this is very much on my mind. As your medical officer of health, I believe your good health is made up of many parts, not just your physical wellness, but your mental wellness, your ability to work, to earn, to support yourself and those you love. I know how much is being asked of those in the affected workplaces. You have my assurance that none of us in positions of responsibility have forgotten what we're asking of you. I will do all I can to help find ways to help you weather these temporary restrictions during the next few weeks. Still, it doesn't feel temporary if it affects you personally. So in the conversations ahead with my peers and colleagues, I will speak up about what we've asked of you. I believe I will be heard, and that you will be heard too. As difficult as it is in many respects, the actions poised to come into effect will make it harder for COVID-19 to spread, by reducing our ability to mix in situations that make it easier for the virus to spread. If we rob COVID-19 of that, a declining infection rate has to follow. The rest of us can show our respect for those of whom we're asking so much by acting in ways that will make it harder for COVID-19 to spread. That is what we need. Reduced spread means lower infection rates, which means a healthier, safer Toronto, where people can work more, connect more, and live more. But until then, we have the next few weeks to get through, and in the next few days, Thanksgiving. My advice is that you are safest spending Thanksgiving only with the people you live with in your home. That isn't an easy ask of people who live alone, and I am sorry that I have to ask it. But if at all possible, connect virtually rather than in person. And if you must be with other people that you don't live with, try to do it outside. Always keep at least 6 feet apart. Wear your mask as much as you can, and wash your hands as much as you can. This will be a Thanksgiving most of us will always remember, and one we'd probably rather forget. I hope it's some consolation that what we have to do this weekend should give us something to be really thankful for this time next year. And I hope that you will take pride in knowing that you are doing the right thing. This weekend and in the weeks ahead, I ask you to always ask yourself these questions. Is where I'm going something I need to do or something I want to do? And if it's just something I want to do, can I put it off? In either instance, what can I do to make it lower contact? Can it be outdoors? How much am I able to stay at least 6 feet apart from others? Have I got my mask to wear? These things are important because the changes we're about to make in city life will take time to show results. Lower infection rates won't happen overnight. So the infection rates still to come over the next few weeks will require faith that we are on the right path. We have seen, since reopening, the inevitable consequences of letting our guards down and living as if we're back to normal. That day has not come, not yet, but I believe it will if we commit to living differently for now, in order to live normally again. Today is an important day as we act to contain and control COVID-19. We are all united in our desire to get COVID-19 under control. This is not the moment to breathe a sigh of relief, but rather the time to take a deep breath before we make up our minds to do what that takes. With that, I'll now hand it over to Chief Pegg for his remarks.
Thank you, Dr. Davila. Good afternoon. Throughout the COVID-19 pandemic, the City of Toronto has been on the forefront of proactive planning and response. We have worked hard to ensure that our plans are robust and flexible, such that we are well positioned to respond to the rapidly changing situation that continues to define COVID-19. Our COVID-19 Strategic Command Team, in collaboration with the city's senior and corporate leadership teams, remain focused on doing all we can to save lives and prevent our healthcare systems from becoming overwhelmed. We have comprehensive resurgence plans in place, and those plans are informing every decision we make. Each of the city-operated critical and essential services have been provided without interruption throughout the pandemic and will continue to be. In response to the challenges associated with COVID-19, we have evolved the delivery model for the vast majority of city services, such that they are being delivered in innovative ways by leveraging technology-enabled platforms and other made-in-Toronto solutions. We have worked hard to ensure that our city services are well-positioned to continue during this period of COVID-19 resurgence. At present, more than 90% of city services are operational, with more than 65% of those services operating remotely through enhanced technology. The handful of services that have not been restarted are those that would require in-person attendance and would necessitate opening our civic facilities to the public. The restrictions and regulatory framework relating to COVID-19 continues to evolve. Our team is working non-stop, and we are responding in live time as things develop. We are prepared, and we will continue to respond. As we head into the Thanksgiving long weekend, our teams will continue to be hard at work. Our COVID-19 enforcement teams will, of course, be active all weekend. This will include proactive inspections across the city, as well as responding to complaints relating to gatherings and other COVID-19 safety regulations. I met with Carlton Grant, our Executive Director of Municipal Licensing and Standards, and Toronto Police Chief James Raymer this morning, and our teams are coordinated and ready to do all we can to protect public health and safety both this weekend and beyond. Maintaining compliance with public health measures is critical to controlling the spread of COVID-19 in our city. Complaints with respect to gatherings or other COVID-related orders should be submitted to the city via 311. I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. On behalf of your entire COVID-19 incident management team, I wish everyone a safe and happy Thanksgiving weekend. But I know this can be a tough weekend for many. It is okay not to be okay, and reaching out for help when we need it is a sign of strength and courage, not weakness. I encourage everyone to take some time to check in on those around us this weekend. We are all in this together. There are important mental health supports and information on our toronto.ca/COVID-19 website, and I encourage you to take a few minutes to review this important information. Thank you.
Okay, thank you, Chief. We have a number of staff on the line to answer any specific questions reporters may have, including staff from shelters, bylaw enforcement, parks and rec, transportation services, and senior services and long-term care. First question is to Matt Bingley from Global News. Please go ahead, Matt.
Hi, good afternoon. Dr. Davila, I was just wondering if you could clarify the way that the fitness restrictions and recreation restrictions now fit into the provincial ones, because as I think as I just heard, a fitness center at a rec center would be allowed to stay open along with lane swimming, but I'm just wondering how that's different from a gym such as Good Life being ordered to shut down, and why a fitness center and a rec center would not be subject to the same orders.
So, Matt, I think you asked some excellent questions, and I think we have to really look at the provincial regulations to understand exactly what the criteria are. And I'll be upfront, I haven't yet had an opportunity to take a look at the regulations. I've heard some general comments, but I don't want to speak on the basis of that which I've heard verbally. So once we actually have a copy of the regulations, or I've had a copy, an opportunity to see a copy of the regulations, I'll be in a better position to speak to what exactly is required, and I would imagine our enforcement colleagues as well will be able to speak to that better once they have an opportunity to see those regs.
Maybe what I can do is ask Howie Dayton from Parks, Forestry and Recreation to speak specifically to any changes. Howie? How are you there? Okay, we'll get back to you, Matt, on that. If you have a second question?
Hello?
Oh, hey, Howie, sorry. Go ahead, please, Howie. Fitness centers and recs, parks and rec facilities. All right, we'll come back. Go ahead, Matt, with your follow-up.
Okay, I'll follow up
Sorry
on that
about
later. I guess my next question is, Dr. DeVille, I'm just wondering if at this stage, if you're looking for any other problem areas for things that you might want to focus in on. I'm just recalling back to the spring when parks equipment was blocked off because they were high touch and not easy to clean, and playgrounds and stuff like that. Is that something that you're seeing as perhaps something that you need to look at as well?
So, Matt, I would say at this stage, we've learned a lot about the virus. I'm not going to tell you that we know absolutely everything about the virus. If there is something I can say, it's that it is a humbling virus to contend with. That being said, we do know more, and we know that at this point that there is less of a concern around playgrounds. I think back in the spring, we were less familiar and we had reasons to be concerned, and so we took a very precautionary approach. Now recognizing that the virus really is primarily spread through that direct close contact with infected individuals, that's less of a concern now, and I'm happy to say that we are actively encouraging people to maintain physical activity, to get exercise, and in particular to do so outdoors where the risk of virus transmission is significantly reduced.
Okay, we're going to go back to Howie Dayton from Parks and Rec, who can clarify for you, Matt, on the fitness centers in city facilities. Howie? All right, well, Matt, what I can tell you is that fitness centers in parks facilities will close tonight at midnight or 12:01 a.m. If you need more, we can chat after this presser. We'll go next to Mark McAllister from City News. Mark?
Thank you. A very basic question for Dr. Davila. At this point, is what the province announced today enough for you? And what would be, I guess, the next stage for you? What will you be watching for from this point forward before more restrictions are put in place?
So, Mark, I think that the province has taken the necessary actions at this stage, premised on the data that we have and the best available evidence using the experiences of other jurisdictions. I am content to see that these actions are being taken, and I remain hopeful that they will give us the kinds of outcomes that we're looking to see in terms of reducing COVID-19 infection rates. That will not happen right away. I just want to emphasize that. It will take at least a few weeks before we really start to see the full impact of the public health measures that are being taken. So again, I would ask the people of Toronto to have some faith that this is the right path. Knowing what we've experienced in the spring, we know what makes a difference in terms of controlling the spread of this virus. The kinds of actions that are being taken and that are put up here by the provincial government today are exactly the kinds of actions that we know will make a difference in terms of controlling the spread of COVID-19. So we will continue to watch the numbers, and I would ask us to watch very carefully, not just case counts, but what's happening in terms of percent positivity, what's happening with laboratory tests, what's happening in our healthcare system, and what's happening within public health, and what is our capacity to respond. It is the combination of all these indicators that we have to monitor very carefully, in order to ensure that the actions that have been taken are having the desired impact on reducing COVID-19 spread.
And Mr. Mayor, if you could, throughout this entire pandemic, a number of TO initiatives have been launched. Aside from the rec programs and facilities being scaled back this morning, at what point do you start discouraging people from taking part in some of these other programs and asking them to stay out or stay away?
Well, I think our objective is to try and find as many programs, new ones or old ones, that we can, that allow people to be active and to be able to entertain themselves, because it isn't just about physical activity, that's important. It's also about sanity and people's mental state of well-being. And so as we speak, we're working on winter activities that we can, perhaps supplement our other programs with that are allowed to keep going. We're looking for ways, as we did in the summer, to find ways to keep programs going that we had to suspend as of midnight, but maybe we alter them and make it possible for to have a modified program, because we think it's very important to provide people, especially in some of the areas where people have less opportunity to do things than maybe some others, that we make those opportunities available to them. So we're working hard on that, and the staff's on that, and we'll be having as broad a range of programs as we possibly can. And by the way, the jobs that go with it, those are important too.
Okay, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey there. My question's for Dr. Davila. The province, in data that they sent to reporters underlying their decision today, made the connection to what they say suggests exponential growth, similar to what's happening in Victoria and in Melbourne. So it's hard not to make other comparisons, including that in Melbourne, they instituted pretty serious lockdowns, including a nightly curfew when they had reached something like 680 cases, and only recently removed that curfew when they're now just at average of just under 10 cases. So I'm wondering, is what we've done today enough, and should we not be looking at further measures now that we've seen similar growth?
So, Jennifer, I think each situation needs to be assessed on its own, and each city and each jurisdiction has its own unique circumstances. I think that what has been proposed in terms of actions to control COVID-19 spread here make sense and are appropriate to what our understanding is of our local circumstances. But as I mentioned earlier, we will continue to monitor, as we have throughout, the many categories of indicators to help us understand whether the actions that we're taking are in fact having the desired impact, recognizing that it will take some time before the measures taken actually do have that desired impact, whether we're talking about virus spread, the laboratory indicators, healthcare measures, or public health measures. So I think that it's responsible and appropriate and part of public health practice to take actions in concert with the data and the evidence that you have, and to adjust the course of action, also premised on what the data and the evidence suggest is the right thing to do.
And just to follow up for both of you, I've heard you both praise the province for what they did today, and that's understandable given that they've enacted measures which, Dr. Davila, you asked for. But they've done so 7 days after you first told them, as the city's top doctor, that these measures were needed immediately to stop virus spread. We know from experts that hesitating even a day or a week can lead significantly to far more cases. And I want to ask both of you, did we really miss the mark here? We acted a week after you said we should have, and that could have a serious impact, it seems, on the residents of this city.
I think, when these questions get asked, they're very fair questions, but I think to some extent they underestimate the incredible complexity, the difficulty, the agony that you go through in trying to make the right decision. Dr. Davila rendered what was very clear advice to us, and it was advice we could not enact on our own. That's why the letter was written to the Medical Officer of Health. We've then engaged in what I think was a good faith exchange of data with the province, and lots of dialogue going on both at the expert medical and political elected representative level. And, in the end, they came to the right decision today. And whether it happened a day earlier or a day later, you could comment or people could try to assess whether that is going to make a big difference or not. But the bottom line is we ended up in the right place. I know the Premier agonized over this file. I know that from talking to him. I know that from watching him deal with it. And I will just say that we ended up in the right place. And I think that's what people really care about. And I hope it's going to protect a lot of health and even save some lives, and that the assistance programs will also help save some businesses.
So, Jennifer, I think if I can add to that, it is that the mayor is quite right. These are very difficult decisions and issues to grapple with. So I think I would just say that, look, on the beginning of the Thanksgiving weekend, I'll just say that I'm thankful that we have landed where we're at now, and I do hope that we will start to see the impact of these decisions in the numbers as we've discussed, in the weeks to come.
Okay, well, thank you very much for joining us, everybody. That concludes today's briefing. Please have a safe and happy Thanksgiving weekend. You as well, thank you.